How your weight affects your bedroom performance as a man. Erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Erectile dysfunction is a common condition that affects millions of men worldwide. While it is often associated with aging or underlying medical conditions, an increasingly important factor in understanding erectile dysfunction is weight. Excess weight, particularly obesity, has been shown to play a significant role in causing, exacerbating, or being linked to erectile dysfunction. The relationship between weight and erectile dysfunction is complex and multifaceted, involving physical, hormonal, and psychological mechanisms. In this video, we'll explore how your weight affects your sexual health, particularly in relation to erectile dysfunction. We'll examine the scientific connections, discuss the pathways through which weight impacts erectile function, and offer practical advice on how to address weight-related erectile dysfunction. Obesity, particularly abdominal obesity, is strongly linked to an increased risk of erectile dysfunction. Research has shown that men with a higher body mass index, BMI, are more likely to experience erectile dysfunction than those with a healthy weight. This association can be explained through the following pathways. 1. Vascular health and blood flow. Healthy blood flow is essential for achieving and maintaining an erection. During sexual arousal, blood fills the erectile tissues of the penis, resulting in an erection. This process depends on the proper functioning of blood vessels, which is compromised by excess weight. When someone is overweight or obese, they are more likely to develop conditions like hypertension, or high blood pressure, and atherosclerosis, the buildup of plaque in arteries. Both of these conditions narrow and stiffen blood vessels, reducing their ability to deliver blood efficiently. Moreover, excess weight increases cholesterol levels, leading to fatty deposits that can clog blood vessels. This impairs the ability of blood to flow freely to the penis, which is necessary for a strong erection. Nitric oxide, a molecule produced by the endothelial cells lining blood vessels, plays a vital role in vascular health. It relaxes and widens blood vessels to allow adequate blood flow. In individuals who are overweight, chronic inflammation and oxidative stress damage these endothelial cells, reducing nitric oxide production. The result is endothelial dysfunction, a condition closely linked to erectile dysfunction. In severe cases, reduced blood flow can lead to vascular erectile dysfunction, where even strong sexual stimulation fails to achieve an erection due to physical blockages or poor vessel elasticity. 2. Hormonal imbalances. Hormones play a central role in regulating sexual health, and weight significantly influences hormonal balance, particularly in men. One of the primary concerns for overweight individuals is a decline in testosterone levels. Testosterone is the main male sex hormone responsible for libido, or sexual desire, sperm production, and erectile function. Adipose tissue, or fat cells, produces an enzyme called aromatase, which converts testosterone into estrogen. As a result, men with higher amounts of body fat often have lower levels of testosterone and elevated estrogen levels. This hormonal imbalance leads to reduced libido, difficulty achieving erections, and in some cases, symptoms like gynecomastia, or enlarged breast tissue in men. Additionally, obesity can lead to insulin resistance and type 2 diabetes, which further disrupts hormonal balance. Insulin resistance often increases levels of sex hormone-binding globulin, SHBG, a protein that binds to testosterone and makes it unavailable for use. This reduces free testosterone, the active form of the hormone, compounding the problem. Low testosterone levels, known as hypogonadism, also impair nitric oxide production, further contributing to vascular issues that cause erectile dysfunction. This hormonal disruption creates a vicious cycle where weight gain worsens hormonal health, leading to more significant erectile problems. 3. Inflammation and oxidative stress. Chronic inflammation and oxidative stress are byproducts of excess weight and contribute to a wide range of health issues, including erectile dysfunction. Adipose tissue, especially visceral fat around the abdomen, is metabolically active and releases inflammatory molecules called cytokines. These cytokines include tumor necrosis factor alpha, TNF-alpha, and interleukin-6, Illinois-6, which cause systemic inflammation. This chronic inflammation damages blood vessels and reduces their ability to function correctly. The endothelial cells that line the blood vessels are particularly vulnerable to inflammation. Over time, this damage leads to endothelial dysfunction, making it difficult for blood vessels to dilate and deliver blood to the penis during arousal. Oxidative stress occurs when there is an imbalance between free radicals, unstable molecules, and antioxidants in the body. In overweight individuals, oxidative stress is often elevated due to poor dietary habits, lack of exercise, and chronic inflammation. Free radicals damage blood vessels, impair nitric oxide production, and exacerbate inflammation, all of which contribute to erectile dysfunction. Inflammation and oxidative stress are also linked to other conditions such as diabetes, hypertension, and cardiovascular disease, which further amplify their negative effects on sexual health. 4. Psychological factors. Psychological health is deeply intertwined with sexual performance, and weight-related issues can profoundly affect a man's mental and emotional well-being. Overweight and obese individuals often face societal stigma, which can lead to low self-esteem, body image concerns, and feelings of inadequacy. These psychological factors can create anxiety about sexual performance, known as performance anxiety, which further impairs erectile function. Depression is another significant psychological factor associated with weight gain and obesity. Depression can lower libido and energy levels, making sexual activity less appealing or enjoyable. Additionally, some antidepressant medications prescribed for depression can have side effects that worsen erectile dysfunction. Stress, whether related to weight, work, or personal relationships, triggers the release of cortisol, a stress hormone. Elevated cortisol levels over time can suppress testosterone production, reduce libido, and interfere with the body's ability to achieve an erection. This creates a feedback loop where the psychological distress caused by weight contributes to erectile dysfunction, which in turn worsens emotional health. The psychological toll of erectile dysfunction itself cannot be underestimated. Men who experience erectile dysfunction often feel embarrassed, frustrated, or ashamed, which can lead to avoidance of intimacy and strained relationships. 5. Sleep apnea and poor sleep quality. Obstructive sleep apnea is a condition in which breathing repeatedly stops and starts during sleep. It is strongly associated with obesity and can have a direct impact on erectile function. Sleep apnea reduces oxygen levels in the blood and disrupts the body's ability to produce nitric oxide, a molecule crucial for blood vessel health and erections. Poor sleep quality caused by sleep apnea also interferes with the body's natural production of testosterone, which primarily occurs during deep sleep. Men with sleep apnea often experience chronic fatigue, low libido, and difficulty achieving or maintaining an erection. Weight loss can significantly improve sleep apnea symptoms and, by extension, erectile function. Studies have shown that men who treat sleep apnea with continuous positive airway pressure therapy or through weight loss experience improvements in testosterone levels and sexual performance. Even in men without sleep apnea, poor sleep quality linked to obesity can negatively affect erectile health. Inconsistent sleep patterns disrupt the body's circadian rhythm, which regulates hormone production, energy levels, and overall well-being. 6. Insulin resistance and diabetes. Excess weight, particularly visceral fat around the abdomen, is a major risk factor for insulin resistance, a condition in which the body's cells become less responsive to insulin, a hormone that regulates blood sugar levels. Insulin resistance often progresses to type 2 diabetes, which is one of the leading causes of erectile dysfunction. Diabetes damages the small blood vessels and nerves that are essential for achieving an erection. High blood sugar levels cause glycation, a process in which sugar molecules bind to proteins and fats in the body, leading to stiffened blood vessels and reduced elasticity. This impairs blood flow to the penis and reduces the effectiveness of nitric oxide. Diabetes also affects the autonomic nervous system, which controls involuntary processes such as blood vessel dilation during arousal. Diabetic neuropathy, or nerve damage caused by diabetes, is a common complication that directly affects the nerves responsible for triggering erections. Furthermore, diabetes is often accompanied by hormonal imbalances, including low testosterone levels. The combination of vascular, neurological, and hormonal damage makes erectile dysfunction more severe and challenging to treat in men with diabetes. Managing blood sugar levels through diet, exercise, and medication can help mitigate these effects, but the damage caused by prolonged diabetes is often irreversible. This underscores the importance of addressing weight-related insulin resistance before it progresses to full-blown diabetes. Practical steps to address weight-related erectile dysfunction. If weight is contributing to your erectile dysfunction, here are some practical steps you can take to improve your sexual health. 1. Adopt a balanced diet. Focus on a diet rich in whole foods, including fruits, vegetables, lean proteins, whole grains, and healthy fats. The Mediterranean diet, which emphasizes olive oil, fish, nuts, and fresh produce, has been shown to improve both cardiovascular and erectile health. 2. Exercise regularly. Regular physical activity helps burn calories, improve circulation, and boost testosterone levels. Aim for at least 150 minutes of moderate-intensity exercise per week, such as brisk walking, swimming, or cycling. Strength training is also beneficial for building muscle mass and enhancing metabolism. 3. Manage stress. Chronic stress contributes to weight gain and hormonal imbalances. Practice stress-reducing techniques such as mindfulness, meditation, or yoga to improve your overall well-being and sexual health. 4. Seek medical support if you're struggling to lose weight or manage erectile dysfunction. Consult a healthcare professional. Medications, therapy, or supervised weight loss programs may be helpful in addressing these issues. 5. Prioritize sleep. Improving sleep quality can enhance testosterone production and overall health. Establish a consistent sleep schedule, create a relaxing bedtime routine, and seek treatment for conditions like sleep apnea if necessary. Weight plays a significant role in erectile dysfunction, influencing it through physical, hormonal, and psychological pathways. Obesity and excess weight can damage blood vessels, disrupt hormonal balance, and increase the risk of conditions like diabetes and sleep apnea, all of which contribute to erectile dysfunction. However, by addressing weight through healthy lifestyle changes, many men can significantly improve their erectile function and overall quality of life. Losing even a small amount of weight can lead to noticeable improvements in sexual health, including better blood flow, increased testosterone levels, and reduced psychological stress. If you're experiencing weight-related erectile dysfunction, know that help is available, and taking steps toward a healthier lifestyle can make a meaningful difference. If you found this video helpful, don't forget to like, comment, and subscribe for more tips on living your best life. Thanks for watching, and I'll see you in the next video.